great publications on non-expanded SVF on MS patients. We've seen it in some of the autoimmune cases we're doing. Does it last forever? No. They need repeated infusions. We're seeing about 6 months' time. And so, going on to that, and I am cutting a very long story short, ladies and gentlemen, but we've developed synthetic peptides according to those things we saw secreted, the amino acid sequences we saw secreted. We've got 3 candidates that we're currently doing a lot of research for. We've termed them addiceuticals, or 8813. We had done one patient in the Philippines who was ex-rehab patient with chronic fatigue syndrome, so forth. They never told us he was a HIV positive patient, but they did tell us 2 months later that his viral count, his father had come, who was a doctor, infectious disease physician, came and told us my son's viral count has dropped by a couple of log factors, and we thought, well, okay, well, this might just be a placebo effect, I don't know. But we have attentively looked at one of the peptides, and it's shown great safety. I mean, like with all drugs, you've got to do safety studies, you've got to do preclinical studies and so forth. We've got to the point where we're doing our first clinical trial in South Africa on HIV patients, and then looking at further formal trials in Malaysia and Haiti that are being set up at the moment. We've got another candidate that we found releases endorphins. If you put it on your skin in a cream form and you've got some superficial pain, within 5 minutes there's some bettering of that pain. So that's something else we're looking for. We're seeing that it releases beta-endorphin from keratinocytes, and that's something, of course, once again, you've got to go through your phase 1, phase 2, phase 3 in your preclinical. But more importantly is we've able to find a small peptide sequence that is able to block that interleukin-1 receptor. And this is something that Amgen and a lot of big companies are looking at, because if you can block, just like TNF-alpha inhibitors, if you can block that first part of the inflammatory cascade, that is of main interest in many different disorders, as what IL-1RA has been shown to be good for. So I'll just finish off showing you at least what's happening with the HIV trial. This peptide, even at 10,000 times the dose we're using, has been shown to be non-toxic, at least in animal studies. If we give an injection of this peptide subcutaneously, a week